Hello, this is Dr. Lee from Integrative Solutions for the Ankle. Today we are going to talk about a different kind of bunions today. We're going to talk about bunions of your pinky toe, your little toe right here. So when we talk about bunions, a lot of people just instantly think of the big toe bunion. While that is true, there is second type of bunions that are not as frequent but detrimental to patients' health or people's health in general. It's called Tailor's bunion right here. We call it Tailor's bunion because in the old days, tailors used to get it for using their foot pedals so much while they are doing tailoring work. So what is the difference between the bunions over here and bunions over there? The location is a little different, but the biomechanisms, how you get it, is very similar. Just like I said last time, the bunions of your big toe joint right here happens because there are biomechanical or movement problems of your bones in the back of the heels, the middle part of your foot, as well as the front part of the foot. It's a very similar thing. When there is inherent instability of the back of the heels moving too much and unstable, it will translate into instability in the middle part of the foot, especially to this bone called cuboid. So when the back of the heel start to deviate outside here like this bone right here has to come with it to outside. Why? Because there has to be stability so that you can walk. If all the muscles that are attached to here and here comes with it, you start to develop a little bump this way. After all, your foot needs to be stable enough to walk. So your foot will do everything it takes to get your foot stabilized so that it can have a proper functioning foot, so that you can walk without problems. And I always say the little bumps here like this are more often painful than big bumps like this. And this is no different. A lot of people who suffer from Tailor's bunion, they have a lot of pain. So what do we do? What do we do to fix it? In order to fix your Tailor's bunion, it is important to stabilize the unstable area such as the back of the heel, middle part of the foot, also the front part of the foot. This is where orthotics come in. Orthotics is like glasses to your eye, but since you cannot put glasses on the foot, you put this. And it goes between your foot and then your shoes to make your foot to be more normal shape so that it will be functioning more normally. With a properly prescribed and dispensed orthotic made by doctor and prescribed by the doctor, should be able to capture and control any kind of unstable areas part of the foot, such as the back of the heels, middle part of the foot, and even the front part of the foot. So you'll be able to get a properly functioning joint in the foot. You'll have less stresses in this area. If the Tailor's bunion is painful enough and the bump is big enough, you can always wear a sleeve to protect yourself from the painful bump right here. Also, wearing the correct shoes, which is going to be wide shoes that are going to be big enough so that it does not rub against your foot directly, is an essential thing that you must do to make sure that you don't get pains from your Tailor's bunion. If you are suffering from a sharp pain at your bunion bump right here in your little toe, you can get a couple shots of injection at this area to relieve the pain that you're experiencing. But remember, injection only takes the pain away. It does not take away the problems, the biomechanical problem, the bone moving problem of the entire foot. If your Tailor's bunion problem has been ongoing for such a long time and then you have a lot of pain to your little pinky toe right here, surgery could be good options as well too. Surgery is not a reversible procedure, which means once you have it, you have it. So it is my opinion that you should catch your foot problem early enough so that you can take care of your foot problem more naturally and more conservatively. Also, it is important to address any kind of areas in your leg or your knees, on your hip, your thighs, even your low back that has been caused by your little toe problem right here. If you had problem right here for many years and you've been walking funny certain ways for many months or years at a time, you do have some problems that you have created in other part of your body, such as your low back and your knees. Sometimes, in order to fully correct the problem right here, you have to go back and address those areas also to fully address the issues right here. So it is important to address this problem right here with overall body approach. The lesson is this. Make sure that you go see a foot doctor regularly for a checkup so there won't be any problem right here. There has to be some kind of biomechanical problem that happens here and here, eventually translating the problem to the small toe right here. So it is important to get your foot checked by qualified professionals on a regular basis so that you can prevent things like Tailor's bunion, because it takes time for you to be able to get this. You don't just wake up one morning with this problem right here. I hope you enjoyed the video. If you liked, please press the like button and subscribe to our channel, and then we'll bring more useful content for your foot and ankle health. Once again, this is Dr. Lee from Integrative Solutions for the Ankle. I hope you will. Take care. Be well. Bye-bye.